Is working from home causing hyperacusis? Be mindful of decreased sound tolerance. Everyday sounds can quickly become overwhelming. Hello again, and thanks for tuning in to our latest video. In this video, we will talk about problems with certain sounds which are increasingly common these days, affecting many people working in home office environments. What is typical to all these people suffering from this type of decreased sound tolerance is how they are affected by some specific sounds, usually high pitch, while being able to tolerate complex sounds, such as traffic noise or even music. These individuals show good tolerance to even loud, complex sounds, yet they suffer significantly from exposure to not so loud, but very specific sounds such as microwave beep tones, HVAC systems, and many other very common sounds we usually don't even notice. When sound tolerance decreases, treatment is usually recommended. Unfortunately, a major issue is that not everyone tested in a typical hearing clinic can detect or even recognize the abnormal sensitivity to sounds they are experiencing. Even if those sufferers report significant challenges, uncomfortable loudness tests often show normal responses, even at levels like 100 decibels. This can make it seem like nothing is wrong with the auditory systems. Even after being seen by the ENT specialist in most cases, tests show no inflammation or anything else which would indicate some medical problems. Usually, the occasional feeling of clogged ears, fullness in the ears, or even clicking is treated as a sign of possible sinuses and diagnosed as eustachian tube dysfunction problems. This type of auditory system problem is becoming more and more common as more people work from home offices. It also takes time and research to find somebody who would have the knowledge about it and could correctly diagnose the presence of this particular problem by using specialized tests for this purpose. Many sufferers search internet in the hope of finding explanation and remedy the problems they face. Some people feel that the term hyperacusis fits their experience, while others are less satisfied, especially if they also have tinnitus, though it may not yet be severe. Then there are those who lean toward misophonia as a better match for their symptoms, often after researching online. From the clinician's perspective, specialized testing is needed to understand the nature of the problems affecting people complaining about this form of decreased tolerance, and a very good report coming from the sufferers. Can this condition be treated? In most cases, yes, but it takes quite a bit of expertise and experience to be successful. What we recommend to our clients is a consultation with some tests performed as well, as this condition can become a major problem for many, having a severe effect on their lives. Tests are followed by treatments, which include a registered psychologist, CBT, and mindfulness therapists. Addressing emotional issues is crucial because stress or anxiety has a huge impact on how severe this condition is, and it has an effect on the treatment progress. Specialized protocols and frequent retesting are ultimately required to verify the effectiveness of treatment tools and monitor progress, making it quite complex to help someone with what's often described as sensitivity to certain sounds. However, if left untreated, like many other hidden conditions, what seems initially minor can evolve into a significant issue, profoundly impacting the sufferer's life. Over time, this decreased tolerance for sounds can become debilitating and seriously affect their quality of life.